Han! Han! Mga nagkasiguro ko na. Han! Han! Hoy, asa ka? Han! Nag-late na akong pamubot na! Oh my God! Jesus, Han! Hoy, asa pa ka? Nagunsa ka, oy! Tana mga tanatag hospital, my God!
Pagsyo, di tata, matutong hospital. Dok, maluoy ka, Dok. Dok, mga anak na kong uyab, Dok. Maluoy taon ka, Dok. Tabangi taon mi. Dok, maluoy ka, Dok.
Oh. Oh, sige, palingkuran. Palingkuran si man ganun. Dok! Beshi, please call my parents, Beshi. Nga mga anak ko, Beshi.
Okay, Beshi. Ako yung bahala. Wala ka din ha. Pero na importante ka rin.
Nurse Beth, please lang ako sa room 501. Salamat. Asa naman itong mga residente dire?
Run.
Okay, so good evening everyone. Yes, I am Dr. Paz and you are going to be under me for the rest of your residency training. Okay? So first things first, di ko ganahan og late. Okay? Di ko ganahan og langayan, di ko ganahan tapulan, o di ko ganahan tangaon. Right? So I want attentiveness to be the core of this group. Understood? Okay, sige. So, ready yourselves because we're going to do a delivery today. Okay? And yes, the extra pressure because the consultant will be with us. So I want everyone to be at the top of their game. Right?
Karon jud first day, Doc.
Well, of course, Dr. De La Cruz. Is there a problem? Well, dapat ready ta permi kay anytime na ay pwedeng mga anak. Okay? Sige. So everyone, are you ready to learn?
Yes, Doc.
Yes, Doc.
Yes, Dok.
Okay, so let's start. Let me present the case first. So this is a delivery of a 29-year-old woman who is a G2P11011, 40 weeks and 3 days of AOG by LMP, who is now here for cramps and increased back pain. Okay? Sige. So how would you describe the succeeding parts? Let's start with the first three girls. Sige na, dali.
The past medical history and family history of the patient are both unremarkable. So our patient here is a non-smoker, non-alcoholic drinker, and has no record of any illicit drug use.
Her first weight is at 25, no STD.
Patient had her menarche at 12 years old, occurring at 28-day interval, lasting for 4 days, soaking 3 pads per day. She also experiences dysmenorrhea. The last normal menstrual period was February 14, 2020.
Okay. So meaning, this is your second pregnancy na. Di ba? Oo. Okay, so the first one was an uncomplicated breech delivery. So which would mean nga, Dr. Mina.
Which means one na siya kamulo?
Of course, that is already given, Dr. Romina. But what does the context mean?
There's a 10% possibility that this will also be a breech delivery. And in the instance that this becomes breech, then the third child will have a 28% chance of being delivered in the same manner.
Okay, well read, Dr. Parlade. Okay, so why do breech deliveries happen gani? Dr. Jinko, sige.
Risk factors that lead to breech deliveries are extremes of amniotic fluid volume, where there's twin stock, hydrocephalus, structural uterine abnormalities, placenta previa, and a prior breech delivery.
Okay, so Doc Antipala, can you please describe to me the results of our patient's Leopold's maneuver?
Kailangan ko pa munang huminga. Okay, so for the Leopold's maneuver 1, it's cephalic since you can palpate the head on the fundus. For the Leopold's maneuver 2, the fetal back and the fetal small parts are either on the left side or on the right side. For the Leopold's maneuver 3, it's engaged if it's divergent and not engaged if it's convergent. And for the Leopold's maneuver 4, Doc, it's breech or the feet.
Okay, so what are the 3 types of breech deliveries? Sige, Dr. Tevez.
Frank, complete or incomplete footling.
Okay, sige. So the decision as to how the delivery would work, either vaginal or cesarean, would really depend on our expertise as doctors. Okay? So, we should also follow the rules of ECOG. Okay? So, wala'y pwede mag-experiment. Right? Okay, so now, what do we need man for us to go with the vaginal delivery?
Doc, ako Doc.
Okay.
Make sure that the birth canal is sufficiently large. Cervix must be fully dilated, and if not, push with a cesarean to avoid fetal compromise.
Hey, good evening, Mrs. Tabuan. Yes. Right. Kumusta naman ka?
It looks like,
So,
Doc, pero...
we're going to be your doctors.
Pero laban lang, Doc.
So, relax lang, ha? Sige. Okay, doctors. So, as I mentioned a while ago, the consultant will be here with us today. Okay, so, Dr. Eza Alerta.
Good morning, everyone. Good luck and save a life.
Excuse me, ma'am. Excuse me, sir. Are you the parents of Miss Ria Tabuan?
Yes, Doc.
What
What happened to our doctor?
Doc?
Now, ma'am, your daughter is in labor. So, breech delivery, ma'am, compared to the normal na head would come out first. For your daughter's case, the foot is the one that comes out first. There are certain complications for breech delivery, ma'am, but as doctors, of course, we will really try our best to save both the baby and Miss Ria.
Okay. So, unsa ganito ang 3 types of vaginal breech deliveries?
There's spontaneous delivery, Doc, wherein the fetus is expelled entirely without any manipulation. Next is partial breech, wherein the fetus is delivered up to the umbilicus and the remaining body is delivered by traction. And lastly, total breech, where the entire fetal body is extracted by the provider.
Okay. Alright, sige, let's start. Let's start now with the delivery. Okay. Okay, so similar sa vertex delivery, di ba? Cardinal movements, first engagement, and then mo descend si baby. So once resistance is met sa pelvic floor, internal rotation will then follow. So usually, the anterior hip of the baby would descend first, meaning ang anterior hip will be the one near the pubis. So after such descent, okay, so igabot na, tanawa, igabot na perineum sa baby. Okay, makita na natong anterior hip sa may vulva. And now, the legs will follow and may be born now via spontaneous, wherein we don't need to hold it, or it may require aid. Okay. So now, since the breech kay nigawas na sa introitus, dapat ma-deliver na dayon ang remaining sa body. So karon human naman ang internal rotation, musunod na ang
external rotation, Doc, wherein the sacrum sa baby kay mauna ando sa symphysis pubis.
Okay. Okay, so now to deliver the left leg, we have to place our fingers below sa femur. So we have to abduct the thighs and then with pressure, exerted upward and lateral. Okay. Right, we have to upward and lateral. Okay, sweep it and then do the other side. All right. So now we have to put a towel and then place it at the anterior superior iliac crest. And then thumbs on the sacrum of the baby. Okay, so why do you think do we need to do this?
To minimize the chances of fetal abdominal soft tissue injury, Doc.
Sige, mommy, push pa. Okay, in 1 and push! Sige pa, push!
Cardinal rule in breech extraction is to simply steady, gentle, and downward traction until the lower halves of the scapula are delivered. So if makita ng axilla, rotate the trunk clockwise or counterclockwise para makita ang anterior shoulder. I-deliver ninyo sa arms, position your hands parallel to the humerus. Then sweep the arm downward, across the chest, and out. After that, rotate the baby 180 degrees and then do the same thing sa pikas na kamot.
Okay, so now for the head, one thing to put in mind is to avoid the hyperextension. So what are these maneuvers that we can use?
Ako, Doc. Mauricio, maneuver, Doc.
Okay, very good. So how do we do it, Dr. Romina?
So, the index and the middle finger of one hand should be in the maxilla of the baby, Doc. And then 2 fingers of other hand kay hook over the fetal neck and grasp the shoulders until the suboccipital region is ubos na sa symphysis pubis, Doc.
Okay, so now with continuous suprapubic pressure, We're going to make sure na using both of our hands, dapat balance sa pag-exert, no, sa atong maxilla and sa may neck dapit para dili ma-hyperextend ang head. Okay, mommy? So ready and okay and push. Okay, so baby girl out, 8 o'clock p.m.